Okay, so next, why don't we have a look at the vasculature of the temporal and infratemporal fossae. You can imagine that we are going to have to remove a couple of structures to be able to get a good view, because our blood supply will be mainly derived from the external carotid artery. So to see that, we're going to have to start off down here. Why don't we start off at the common carotid artery and follow it upwards to its bifurcation, where it splits into the internal and the external carotid artery. And if anybody asks you how many branches does the internal carotid artery have in the neck and head region, the correct answer would be 0. However, if it's about the external carotid artery, that becomes quite involved, and we also have a pretty silly mnemonic for this, which would be sal fopsum. You're going to hear this a few more times, and it's going to be shown on your screen. That will actually highlight most of the branches that you will encounter in a laboratory exercise, for instance. So let's have a look at this part here. Here is our common carotid artery, and you can see we're right here at the bifurcation where it splits into the internal over here and the external carotid artery. Actually, directly at this point, there's also something called the carotid sinus, right? Some people might also call it the carotid bulb, for instance. This is an important little region. It's slightly dilated. It's part of the ICA, or internal carotid artery. It's just above the bifurcation, as you can see here. And within the carotid sinus, you're going to find little pressure receptors or baroreceptors, and thus help regulate the blood pressure. So to get a better view, I'm going to go ahead and hide some of the muscles. If you've watched the previous lectures, you might already know some of these here. This one is the posterior belly of your digastric. Remember what it does. It actually helps to elevate your hyoid bone and depress the mandible. The interesting thing about the posterior belly of the digastric, a little Quizlet here, is that it connects through this little sling to the anterior digastric. But even more important is that the anterior digastric is innervated via a branch of the trigeminal nerve, which is called the nerve to mylohyoid or mylohyoid nerve. And the posterior digastric is innervated via the facial nerve. Reason why is embryology. This one here is the stylohyoid. And this is interesting because you can see it really straddles the posterior belly of the digastric as it inserts into the hyoid bone here. This is also innervated by the facial nerve. Kind of makes sense because it's in direct proximity to the posterior digastric. So we're going to hide both of those. And we can move this a little bit further up. So first off, your maxillary artery is going to have 3 parts. If you think, what is the maxillary artery? Well, the maxillary artery is one of the terminal branches of your external carotid artery, right? Your external carotid artery will be ascending, and then right up here is where the termination happens. The 2 terminal major branches of the external carotid artery are going to be your maxillary artery and the superficial temporal artery. The superficial temporal artery, as you can imagine, goes straight up to the temporal region, and the maxillary artery is going to be the one that will then dive deep through the infratemporal fossa and deliver very much needed blood supply here. To make that a little bit more visible, we are going to hide some more of the bony and muscular features that might be in the way. So if we make our way up the external carotid artery and follow all the branches, we might be able to appreciate a couple of important ones here. So let's start down, So let's start down here. What we can see here is the superior thyroid artery, okay? That would be the first one also of our mnemonic, the sal fopsum mnemonic. You can see the superior thyroid artery comes off of the ECA. It arises at approximately the level of the greater hyoid cornu, which is this region over here. It'll pass deep to the omohyoid muscle, deep to the sternothyroid and the sternohyoid muscle, and it travels inferiorly and supplies the superior part of the thyroid gland. The second branch will be called the ascending pharyngeal artery. So now with everything else ghosted, you can see the ascending pharyngeal artery, and this will actually arise from the medial side of your ECA, and branches of this artery, as you can see, the first ones are starting to occur in this region here. They will include the posterior meningeal and the inferior tympanic arteries, as well as, for instance, some branches to the pharynx, so there will be pharyngeal arteries. Overall, you could say that the ascending pharyngeal artery will provide blood supply to the pharyngeal mucous membranes, the stylopharyngeus, and the middle pharyngeal constrictor muscles also. The third branch is our lingual artery, as you can see it here. Let me see if I can isolate it for a second. Here's the lingual artery, and you can see that it is moving towards the midline underneath the tongue. Well, the name kind of already implicates that, right? And so as it originates off of the ECA, just inferior to the facial artery, which is going to be the next one, it'll give rise to several branches, including suprahyoid and dorsal lingual branches, and it'll then end by bifurcating into the sublingual and deep lingual arteries. The next one would be F, as in facial artery. Well, the facial artery is going to be right here, okay? Facial artery I always think is quite interesting. It is fun to find. It is, well, unfortunately for the inexperienced dissector, it is also quite easy to injure because it wraps around the mandible, as you can see here, in very, very close proximity, right? So it'll pass anterosuperiorly over the mandible, and then it'll travel upwards or superiorly, kind of towards the nose, and it'll give off a whole bunch of branches. Branches to the lips that will respectively be called inferior labial and superior labial arteries. In addition to that, it'll also give off palatine branches and submental arteries, of course, below the chin. So overall, we could say that the facial artery and its branches will provide extensive amounts of blood supply to the face, the palate, and the tonsils. The facial artery changes its name to this artery, the angular artery. As you can see, it's kind of on the side of the nose. If we're super precise about it, the angular artery is actually one of the two terminal branches of the facial, because the other one's called the lateral nasal branch. But to keep this compact, we're just going to stick with the facial artery as we've described it now. So the next one will be, we've covered S, A, L, and F. So we're going to have an O, as in occipital artery. Let's have a look where that is. It is right here, okay? As you can imagine, occipital implies that the artery will supply the occipital region, and it'll actually travel together with a nerve called the greater occipital nerve, which is a sensory nerve to the posterior region of the head. And this artery is going to have lots of branches that include, for instance, mastoid, branches to the mastoid process, some sternocleidomastoid branches to the SCM, and some more descending branches. After O comes P in the self-ops mnemonic, and here it stands for the posterior auricular artery. And as usual, the name is the game. The auricle would be the ear. If you add in back cartilage and connective tissue, you can actually see that here's the external acoustic meatus, so that will be the ear. So the posterior auricular artery will come from the ECA, just above the belly of the digastric. It'll travel up and give rise to several branches like stylomastoid, posterior tympanic arteries, as well as some branches that are auricular. As you can see here, they supply the external ear, and also some branches to muscles that lie posterior to the ear, the middle ear, and the parotid gland. Next is S, as in superficial temporal. This should seem familiar now. Here's your superficial temporal artery, and we know this is going to be the one of the two terminal branches of the ECA. The other one's going to be the maxillary artery here, and the superficial temporal artery travels upwards and has many branches like a transverse facial branch and middle temporal arteries, as well as branches to the parotid gland and the ear. So overall, the superficial temporal artery will be supplying blood to the temporal and the parotid regions of the head. And now comes the last one, the M, the maxillary artery. So for the maxillary artery, we're going to have to start our own segment, right? Salfopsum is now covered. The maxillary artery can be subdivided into 3 parts, okay? So the first part of the maxillary artery will be called the retromandibular part, okay? As it passes medially from the infratemporal fossa all the way, look in here, all the way medially here to the pterygomaxillary fissure into the pterygopalatine fossa, which we are going to see in one of the later videos, we can divide it into its 3 parts, right? So the first part is retromandibular because if we add in the mandible again, it'll be behind the mandible. The second part will be called the pterygoid part, and the third part will be called the pterygopalatine part. So now let's go back and have a look at the branches, or the main branches that we should be able to identify of the first part of the maxillary artery. So, first part of the maxillary artery, retromandibular part. Branches. Inferior alveolar artery. This will travel together with the inferior alveolar nerve and supply the mandible, the gingivae, so the gums, the teeth, and the floor of the mouth. This one is fairly easy to find because most people will use a saw or bone snips to kind of like nibble away at the mandible here, and then when you're just deep to it, you will find the IAN and the IAA, so inferior alveolar artery and inferior alveolar nerve. If we continue on here, let's see, what else do we have? This is the personal favorite. It is the middle meningeal artery. This here will supply the dura and the calvaria. This is usually a must-find in any head and neck lab. There might also be some accessory meningeal arteries that will help supply the cranial cavity. The interesting thing about this artery is, very frequently, it will actually dive through a split in the auriculotemporal nerve on its way, through the foramen spinosum, right up here, which is the way how it enters the cranial cavity. See, I have just very briefly turned on all the nerves here, and indeed you can see the middle meningeal artery traveling through a split in the auriculotemporal nerve. This is why I like to call this the most polite nerve in the body. It is actually a branch of V3, trigeminal nerve, but the auriculotemporal nerve will split in two and let the MMA pass right through. There are a couple of additional arteries, for instance the antiotympanic artery and deep auricular artery, that are also branches of the first part of the maxillary artery. However, let's move on now to the second part. Okay, the second part will have arteries that are called deep temporal arteries. This one up here should be one of them. And this is actually called specifically a deep temporal artery that is posterior. Okay, so this will arise from the second part of the maxillary artery and dive deep to the temporalis muscle, so it'll actually supply the temporalis muscle. The amount of these or the number of these will vary quite a lot. Then you have this artery here that often kind of gets damaged during the process of the removal of the mandible because it'll go right through the mandibular notch. So this is the mesenteric artery. And as the name mesenteric implies, it'll provide blood supply to both the superficial and deep parts of the masseter muscle. We also have some pterygoid branches of the maxillary artery. As once again the name implies, these pterygoid branches will travel to the pterygoid muscles and supply them with blood. There's also a buccal artery, and as you can see, it goes to the buccinator or buccinator. So it'll supply this muscle with blood, but also a little bit of the mucosa of the cheek. Now we'll move on to the third part of the maxillary artery. From the third part, you will have, for instance, the sphenopalatine artery. You can already see it has an interesting course because it ends up diving through this hole, which is called the sphenopalatine foramen. So the third part is the pterygopalatine part of the maxillary artery. It travels forwards or anteriorly through the sphenopalatine foramen into the nasal cavity, which we will deal with in another module. And then when it's in the nasal cavity, it'll have many branches, and some of those are septal branches where it'll help supply an area of the nose, which is called the Kieselbach area, which is prone to epistaxis. We also have posterior superior alveolar arteries. They will supply the maxillary molar and premolar teeth, the buccal gingiva, and the lining of the maxillary sinus. And the last one we're going to talk about now is the descending palatine artery. The descending palatine artery will supply the mucous membranes and the glands of the palate, so the roof of the mouth. If I isolate it, you can see it dives into here and will then actually supply the palate. And with the supply to the palate, it will also supply the gingiva.